CDC of cancers that affect both men and women, colorectal cancer is the second leading cause of cancer-related death in the U.S. Those with a family history have a greater risk of the disease. Joining us this morning to talk about what we can do to detect colon cancer early is Gundersen gastroenterologist Dr. Trey Folkers. Good morning, Dr. Folkers. Thanks for getting up with us.
Anytime.
This is a cancer fairly common among both men and women.
Yep, it's a very common cancer, and we encourage everybody to get screened appropriately. And a lot of that has to do with your family history of either cancer or of precancerous colon polyps.
When should those screenings begin, and are we talking about a colonoscopy?
Not necessarily colonoscopy. Screening should begin for everybody at age 50, and depending on your family history of cancer or precancerous polyps, as early as 40 or before that. And the family history really depends on first-degree relatives, so we encourage patients to talk to their parents, children, siblings, and share anybody who has a history of precancerous polyps or colon cancer to share that with the rest of their families.
All right, well, I mentioned colonoscopy. What other screenings are there?
There are stool cards that we can do. CT scans are also performed. The primary screening tool that we use, however, is colonoscopy. If any of those other tests are positive, then we encourage you to get a colonoscopy for treatment.
All right. Once it's determined that you have colon cancer, what is treatment like?
It depends on the stage. It depends on how far it has progressed. If it's early, a surgery is adequate. Otherwise, chemotherapy, radiation are required, and we always work as a team with the surgeons and the oncologists here. So.
Obviously, treatment and outcomes are changing every day. We're getting better as a medical society in treating colon cancer. But what are outcomes like today?
Outcomes are significantly improved from what they have been even 5-10 years ago, and a lot of that is just awareness and people coming in for their screening tests. So.
And there's an event coming up here soon with the loggers to help strike out colon cancer. Can you tell us a little bit about that?
Absolutely. Anybody who's interested, this Thursday night, beginning at 6 o'clock, for the game at 7 o'clock, we'll be meeting and honoring the colon cancer survivors from the region. There'll be a lot of our staff on hand to answer any questions about screening tests, colon cancer in general. And there'll also be free skin cancer screenings and oral cancer screenings. So.
Oh, all right. Well, Dr. Folkers, thanks so much for joining us this morning and talking a little bit about the things we need to do to protect ourselves. And I hope you have a good turnout on Thursday.
Thank you.
All right. Stay with us. We'll be right back.